Right now, we are joined by Dr. Carlos Del Rio. He is the current president of IDSA. Thank you so much for joining us.
Happy to be with you, Katie.
So let's talk about the initiative of the Infectious Disease Society of America in improving compensation and advocacy in the infectious disease workforce.
It's really around increasing the value of infectious disease clinicians. You know, one of the problems that we have is that a lot of the work that we ID physicians do is uncompensated work. You know, the hospital calls and says, we need you to do this, we need to do that, and nobody compensates you for that. If you add to that, in general in our country, we tend to overcompensate procedural specialties. So if you get a surgery, if you get an endoscopy, if you get any procedure, the physicians make a lot of money. And we tend to undercompensate cognitive specialties. So if you are the ID physician who has to review, you know, a long history and have to spend a lot of time with the patient talking and trying to develop a diagnosis, et cetera, that's paid very poorly. So that needs to be corrected. So there's issues around increasing the value of ID, the recognition that there's things we're doing that need to be compensated, but there's also about really shifting that paradigm of, you know, of trying to not undervalue and undercompensate the cognitive specialties.
So in your mind, are there any practical steps that can be taken to improve the compensation?
The first step is to be heard, is to have a seat in the table, is to be open, is to have discussions with some of the leadership at CMS, at AMA, at the different organizations that really set the values and set the reimbursement for different things that we do. And having them listen to us and hear us is the first step, and that's where we are right now.
And when you're talking about contributions, it makes me think of PEPFAR 20 years in. What's the biggest achievement?
You know, PEPFAR is I would say, is a program that all Americans should be very proud of. This is the most important and the most impactful global health program. And what PEPFAR has done is not only has it saved millions of lives, over 25 million lives, that saved millions of children from getting HIV. So we need to be clear about the realities, and we also need to, call our congressional representatives, call our senators, and just tell them to reauthorize PEPFAR.
Final question for you. When we're talking about PEPFAR, what's the next pillar or challenge to conquer?
PEPFAR is moving into now tackling other issues like hypertension and diabetes and multiple other chronic problems. The PEPFAR platform is being used to then build other programs that will do care for more than just one disease. We also need to talk about sustainability, right? How do we start transitioning the program from an emergency program to a permanent program, and how do we get countries to be more and more involved and eventually take ownership? And that is happening, but that's a process. You can't just turn off the light and pretend that the countries are going to be able to take it over. It's a process that needs to occur. It's almost like landing a plane. You have to do it, you have to do it in an intelligent way in order not to crash.
A lot of work to be done. Thank you, Dr. Carlos Del Rio, for taking the time to talk with us.
I appreciate being with you.